My name is Abby Wold, and I'm 30 years old. I lost my legs in 2003 to complications due to meningococcal meningitis and septic shock. I was in a coma for a couple weeks and on full life support with multiple organ failure. And when I woke up from the coma, I lost blood flow to my extremities. So, as a complication to the disease, and because my blood pressure was very low for a long time. So I went through several surgeries to try to repair the damage to the tissues, and it just didn't work in the end. So I ended up having them amputated, both of my legs below the knee. To be brutally honest, my advice to medical professionals, especially nurses that have like one-on-one contact with a patient that has recently gone through an amputation is, number one, for certain people, it's very emotionally traumatic. I had the benefit of actually seeing my feet debrided prior to amputation, and I didn't really want them anymore. So I think I was fortunate in that regard. But people with a traumatic amputation, they wake up and their leg is gone. It's a little bit different. And it is painful. I have had nearly every surgery known to man at this point. I've gone through debridement surgeries. I have had fascial flaps. I have had amputations. I've had a knee surgery. I've had all kinds of stuff. To have your bones cut through, big bones in your legs, is the most painful thing I have ever felt in my life. I woke up from my first two amputation surgeries screaming in the recovery room. So be patient. These people are in pain. There is not enough pain medicine in the world to take the pain away. It will eventually subside as they heal, but I think that maybe there's like a little misconception about how painful it actually is, because I asked before my surgery, is this going to hurt a lot? And I don't think anyone really knew how much it would hurt. And I don't think they intentionally told me it wasn't going to hurt that bad, but it hurt. It really, really hurt. So be patient. It is traumatic on a pain level. It is traumatic on an emotional level. And it's traumatic for their families, too. In my case, I knew after I saw my feet unwrapped the first time, I knew that they were going to have to do something dramatic with them. But I don't think my family was ready to let go at that point, and neither were some of the surgeons. But, families sometimes have a harder time accepting it and dealing with it than the amputee themselves. So the amputee is dealing with that aspect of it as well. So nurses just should kind of take that all in and think about it maybe a little bit. Because on the flip side, when I go in to do a peer visit and an amputee is frustrated with their nurse for not being fast enough or doing enough, I always try to make them remember how busy the nurses are and how, short-staffed they can be, and how there may be something crazy happening down the hall that they don't even think about. So, everybody has a life. Everybody has a story. Everybody's got all kinds of stuff going on, and people should just be considerate of that.